The World Health Organization has released a harrowing report of sexual abuses by its employees in the Democratic Republic of Congo. The report says abuses were committed from 2018 until 2020 by personnel hired locally as well as members of international teams to fight an Ebola outbreak. The investigation found that dozens of women were offered work in exchange for sex and some were even raped. For more on this story, I'm joined by Dr. Aïchatou Mindaoudou, who is the co-chair of the independent commission that actually did this report for the World Health Organization. Madame, a very warm welcome to you and thank you very much for joining us. Perhaps let's start with some context in terms of how this was brought to your attention and you eventually did this investigation.
So thank you very much for having me this morning. You know, the independent commission was appointed by the Director General of WHO after he learned about what happened between 2018 and 2020 in Congo during the response to the 10th Ebola outbreak.
The people of the Democratic Republic of Congo, some very vulnerable because of the situation in that country, right? So this was just something that they did not need, especially some of those women who are already vulnerable to extreme groups that are in that country. What now happens to those who have been found to have committed these atrocious acts?
So it is true the response to the 10th Ebola outbreak took place in a very vulnerable environment. And you know, the problem was that, it is not actually a problem, but the situation was that you have a lot of international community attention brought into the area, and with that, a lot of money. And it was a new wage El Dorado for people. So all this brought this situation, and the vulnerability of women was increased indeed, in addition to what they suffered with the armed group.
I'm curious, Madame, the director of the World Health Organization, Dr. Gebreyesus, says that this report rather makes for harrowing reading. Is this simply enough? What then happens to these people? Have they been suspended? Have they been fired? Will they be facing prosecution?
So it is not enough to feel that the report was harrowing. It is not enough. And indeed, as he recognized himself, it is not also enough to apologize. So what happened to people? What we learned during the press conference is that the Director General suspended 4 people who are still employees of the organization, and 2 of them have been put on leave awaiting for the investigation to be completed. But this is not enough, because we found almost 21 alleged perpetrators, and we put forward recommendations saying that there is a high need to go through really very complete investigations in order to establish their guilt, and then also to punish them. Because the purpose of all this is not to allow this to happen again. And if one knows that in the WHO there is a zero tolerance policy, this cannot be accepted. So people, the alleged perpetrators, should be really punished and brought to justice to respond to what they have done.
Madame, beyond the World Health Organization, there is a conversation happening in the continent on taking a look at the role of aid organizations that come to offer help on the continent, because there have been a number of these incidents just outside the World Health Organization with other organizations. So I'm curious perhaps to get your perspective or your sense on this. How do we better manage this? Is it fair to say that they are a law unto themselves, because who actually watches what they do?
You know, for me, the main problem with regard to this situation that is happening from time to time is that feeling of impunity those employees have. And from where it comes? It comes from the fact that they cannot be trialed and sued unless they are back in their country. So this is a big problem because they will come on the field, they will do whatever they want to do, and then they will run back in their countries, and there is not a follow-up on how they have been prosecuted or sanctioned in their back in their country. So this is very important, and I know that there is a big reflection going on to see how, in cooperation with the international community, the international organization, and also the countries from where those humanitarian workers are coming from, how to deal with this. And also, in such situations, you have the fact that they will be changing positions at any time. They will be changing cities and villages and also working stations. And in the situation of WHO and the Ebola response in Congo, those workers have been brought in an emergency. They didn't check them. When you hire someone, normally you make a kind of background check before this person is brought on the position. But all this situation happens because of really this kind of emergency, and also the senior staff of WHO was focused on really solving the epidemic, and they were not they didn't put any attention in looking at what was going on the border of the actions.
That is rather very unfortunate and very scary that there were no checks and balances. And even though we do respond to the epidemic, it is because it's impacting people and they should be put first. But Madame, perhaps if you can give us an idea of these women that were victim to these men, what sort of help or support have they gotten?
So, unfortunately, I will tell you, and it is sad, they didn't get any support. And it is the reason we recommended to WHO to put a working group that will reflect on the modalities of assistance and also psychological support these women can have immediately. And the said working group also should reflect on possibilities of granting reparation, following duly conducted investigations to see how they can also be granted some compensation. So it is important to assist those victims because, as you know, some of them gave birth to children who are with them, and they are in a very, very, very vulnerable situation. They need assistance.
In terms of civil society groups, you and I, what is it that people on the continent can do to help, perhaps in terms of putting pressure for there, one, to be consequences, to be proper checks and balances before people are brought onto the ground to help, but then end up exploiting people?
Yes. So, it is very important, all of us, as civil society on the continent, we really put emphasis on the importance first on doing the check and balances, not taking in consideration the situation of emergency. Perhaps we can really support the idea of having a kind of folder of clean people who can be called to work when necessary. This is the first thing. The second thing is that all of us, we should really strongly monitor the implementation of the recommendations put forward by the Independent Commission by WHO.
Madam, unfortunately, that's where we're going to have to leave it. But thank you very much. I do appreciate you indulging us. Merci beaucoup. Dr. Aïchatou Mindaoudou joining us from Geneva. She's the co-chair of the Independent Commission that released the report on the World Health Organization workers who have been fingered in terms of having done sexual abuses to people on the ground there.